Namaste all. The latest WHO projections indicates that 1 in 3 of world's population is overweight and almost 1 in 10 is obese. Being overweight or obese leads to many serious health problems, leading to many consequences like heart disease, obesity, musculoskeletal disorders like osteoarthritis. And as we all know, awareness is the key for everything. Today we have Dr. Gondalia, Senior Orthoplastic Consultant of Shalby Hospitals, will be enlightening us about the impact of obesity on knee health and joint replacement. Namaste sir. Here is one question about obesity and bone health. Sir, does obesity damages normal healthy knee bones?
The answer is yes. Obesity definitely affects the healthy knee bone. The obesity nowadays, there is a ready-made BMI calculator available. Everybody can find out their own body's BMI, and there is a very beautiful classification which shows whether the person is normal weight, whether the person is overweight, and whether there is a obese. Any BMI more than 30 is considered as a red alert, and yes, we have observed a lot of adverse consequences on the healthy bone like knee, heel and back.
Okay. Sir, as you said, obesity impacts the bone health. Sir, what is the impact of overweight or obesity on backache?
Good questions. We have observed a lot of female especially patients at the age around after 40s and 50s. If anyone is experiencing backache, then by default we always ask for the weight. The female do not disclose their weight and age, but still it's very relevant findings in patient we have observed. If any female patient having weight of more than around 70 to 75 kg and any male patients having weight of around more than 90 or 95 kg,
Yes.
There is no reason why their back should not pain. There is always, we have observed, direct relation of the weight with the backache, and the medical term which is generalized being used for this symptomatology of the back is sciatica.
Okay.
Sciatica means your back pain starts from the lower back, it travels to the hips, and then it radiates and goes to the all the way to your legs.
Okay.
So this is a very commonly observed symptoms. If anyone is having weight of more than 70 to 80 kg in female and 90 kg in male, then backache is bad.
Sir, does obese patients can undergo knee replacement? If so, what will be the surgical outcomes?
Yes, all obese patients can undergo the knee surgery routinely. We are regularly daily operating the patients having weight of around 120, 130 and 150 kg. This much of weight of patient is considered as a routine in Shalby Hospital.
Okay.
Because this is a high volume operating center. We are getting lot of obese patients across the globes. And what the next question was very interesting. What are the surgical
outcomes?
Apart from getting knee pain relief and walking ability, which they will improve a lot, what is indirect advantage we have observed is once patients start walking regularly, which they won't be able to. Before surgery, most of the patients are coming in a situation like that. Okay, they cannot even walk for more than 10 to 15 minutes.
Yes, sir.
And they go in depression because eventually they even don't go outside their homes also.
Yes.
They even don't share these things with their relatives. After surgery, we have observed miracles are happening. Patients are going for morning walk. They can walk for even hours and hours and kilometers. They can even climb a lot of stairs. They can go to temples. They can visit their places of choices, whatever. Indirect health benefits are there. Lot of health benefits are there. Blood pressure, patient can reduce their blood pressure. Diabetes are getting under control. Lot of endocrine pathologies are getting improved if patient can reduce their weight. So all obese patients is our request. It is our humble request that you should get done your knee X-rays and consult the knee expert doctors whether they are eligible for the surgery, and if it is indicated, then the surgical outcome in obese patient are as good as the normal weight patients.
Thank you so much, sir, for making it clear that obese patients also can undergo knee replacement and outcomes will be great. Thank you, sir. Sir, one more question. Whether routine walking or jogging exercises damages the healthy knee or already damaged the knee joint?
Very good questions. There is a lot of myths which is going in the society, and we have seen that a lot of patients are being advised about not to walk more so that their knees won't get wear and tear. The reality is totally different. If the obese patient having weight of around, say for example 90 or 100 kg, if they don't walk, already their knee are damaged, and if they don't walk further, then again their weight will increase. The increased weight will again damage their knee. So there is a vicious cycle of more weight, more wear and tear.
Yes,
because of more wear and tear, again they will not walk and again they will increase their weight.
Yes.
So it's a totally wrong advice that if you walk less, then your knee will be saved. It's not like that. The arthritis, osteoarthritis, which has already been there, it's generally irreversible. You cannot reverse it because it increases with your aging. And after surgery, what we have observed is patient, if they walk more, they will get an excellent result. So walking at any age, at any stage of life, definitely one should continue without any restriction and hesitation. The patient should discuss all about walking related issues to their doctors, so that exactly what we are practicing is, we never advocate any of our patients to not to walk or to take rest. We always advocate all our patients, they should continue walking for hours and kilometers, whatever they want.
Yes.
That's the advantage of this surgery. Even at the age after 60, 70 or 80s, any age and any weight of patients after surgery, they should walk, and they are able, and after surgery with the grace of God, now all patients are walking very happily.
Sir, one last question. What are the prevent measures you suggest to prevent these problems?
Yeah, prevention is better than cure, as we all know.
Yes.
So the preventive measures to stop the obesity is, one should regularly follow the exercise and diet both. What we have seen is only exercise will not work, diet is also needed, and only diet will also not work, exercise is also needed. Likewise, if we can combine the exercise and diet together, then it gives the excellent results. Another blood screening test which we are regularly using in obese patients is serum uric acid.
Okay.
It has also indirect relation with the drinking and food habits and aging.
Okay.
If one can regularly screen their serum uric acid like the way we use the blood sugar, then you can find out the gout at an earlier stage, and it's a totally correctable medically. So what we do is, we regularly screen the X-ray, we regularly screen the serum uric acid, and if the uric acid is high, if one can take proper medicine at the time, then arthritis can be saved.
Thank you so much, sir, for your valuable time and spreading awareness about obesity, knee pain and joint replacement. Thank you once again, sir.